Laura Marsh. I'm a clinical assistant professor at the College of Medicine, as well as the director of sports medicine fellowship at Texas A&M University. So tanning has been popular for years. Everybody wants a wonderful bronze glow to their skin, but it can come at a cost. And so from a medical perspective, we recommend against tanning either in a tanning bed or outside in natural light. Damage can be done to skin in as little as 5 to 10 minutes of unprotected sun exposure. And so being mindful of that time spent outside for a number of reasons. So the most obvious is sunburn. And so that's the acute, it hurts, it's uncomfortable, particularly if you get to a blistering or a peeling sunburn, that really increases your risk of problems farther down the line. The bigger concern is the chronic damage. And so that sun exposure and the UV exposure builds up over time and increases risk for skin cancer, some of which can be a basal cell carcinoma or a squamous cell carcinoma, but it can also be melanoma, which is the form that can spread and can be fatal. And so that sun exposure builds up over time, over years. There's damage to the cells, there's damage to the tissue. And some people do have more of a genetic predisposition to that, and there's differences in light skin versus darker skin, but we know that there's damage that's done. There also can be damage to the eyes, can increase risk of cataracts, but also of intraocular melanoma, and so if we're outside without sunglasses or sun protection. And then it just increases premature aging. And so the sun exposure, the UV light, damages the collagen and elastin that's in normal, healthy skin. And so with time, as we age, we may not think about it when we're 20, but when we're 50 and there's a lot more wrinkles, there's a lot more sunspots and age spots, that's a result of the UV exposure. So really, there's a number of ways to approach the skin protection. Really, in a lot of ways, the ideal way is hats, long sleeves, true barrier protection. But if we're going to be outside, we're going to the lake, we're going to the park, we're outside with our kids or our families, and we are applying sunscreen, the higher the SPF, generally the better. So we would like to get at least to 30 to 50 on an SPF. There are different formulations of sunscreens. There are the more chemical sunscreens. There's also the mineral-based sunscreens, which have really become increasingly more popular and easier to find, and they're not all a white film like they used to be. But they should be reapplied typically at least every hour. Some will have a little bit longer window, but if we're in the water or if it's being rubbed off, then we may have to do that more frequently. But it's really easy to not realize that a sunburn is happening, and so setting timers and remembering to just reapply that. The tanning beds are, people think it's a safer option. You're not out in the sun, but it's the same idea. You're still exposing the sun, you're exposing the skin to rays that are going to cause tanning, but that's also going to damage the cells. And so you're getting a concentrated dose in a short exposure. They do typically have people wear eye protection so that the vision issues are less of a concern, but the skin damage is still there. So a tanning bed is no healthier than being out in the sun. If you want a tan, you want that appearance, then the tanning sprays and the creams are going to be the safest approach to that. Anything that's sprayed on like that there's a chemical component to it. And so while we don't have perfect data on long-term issues and risks from that, you're still exposing your body to something that's artificial. Tanning creams and sprays that you can purchase commercially, there's some form of a chemical component to that. They're all different, and there's different ones. Some are better than others. But regular application of anything like that is going to create some absorption. That's what it's designed to do, is to absorb into the skin. And so you're exposing yourself, you're exposing your body to outside chemicals. And so the healthiest thing for you and for your skin is to embrace what you have from a skin tone standpoint, and then also to just protect as you're able to with long sleeves, hats, sunscreen. And what we recommend is 5 to 15 minutes of unprotected sun exposure for light-skinned and up to 30 to 40 for darker-skinned. And so anything outside of those kind of daily limits is going to increase your risk for skin damage. When kids are outside in the sun, a lot of times I think we don't necessarily think about the sun exposure unless they're at the swimming pool or they're at the beach. But the cumulative effect of sun exposure begins in childhood. And so even patients that may have started to really embrace sun protection later in life, there's still going to have been damage that was done in childhood. And so we've seen in the past few years an increase in the long sleeve sun guards and rash guards for kids' swimwear, for swim hats and things that are going to cover and protect the head. And so it is important, even with kids that are outside riding their bikes, that they're wearing either sunscreen or they're wearing hats and they're doing things to protect the skin. Don't forget about the scalp. The scalp can burn, and you can develop skin cancer on the scalp as well as on the ears. And we tend to forget about that. And if we're wearing even just a ball cap, then the ears are still exposed. And so making sure that we're being mindful of how long are we in the sun, how much sun exposure do we have, and how it's that protection like. All that to say, we still need some exposure. That's part of how we produce vitamin D. And so we still need that 5 to 15 minutes a day, but we don't want to go past that. I typically advocate for a more mineral-based sunscreen, and there's a number of those on the market now that are streak-free. And so it used to be that if you used a mineral-based sunscreen, you were going to look white. But now the newer developed ones are still a mineral base, which is going to do more. It sits on top of the skin and it blocks the rays instead of really being absorbed into the skin. And so what we're feeling right now is that those are healthier in the long run. Once we've developed that damage, it's hard to totally reverse it. There are some things that we can do as far as making sure we've optimized our vitamin D levels, vitamin C, helping our body to deal with that damage. But what our goal is then is to minimize future damage. And so once we've either been diagnosed with a precancerous skin lesion or even sunspots, or if you've developed skin cancer, whether it's squamous cell, basal cell, or melanoma, we just want to be extra vigilant going forward. We know that there is damage that's been done or there's a genetic predisposition to it. And so we really want to be careful about the sun protection. And so most people, even that I know personally who've had a history of something like melanoma, are very careful about wearing hats and long sleeves and longer pants to minimize that risk. We can't undo what's been done, but we can try to minimize damage going forward.